Today we are going to talk about the otitis media, which is an inflammation of the middle ear cleft. Middle ear cleft consists of the eustachian tube, middle ear cavity, otitis, mastoidantrum, and mastoid cells. Otitis media is of two types, generally suppurative and non-suppurative. Suppurative type include otitis media, which is acute and chronic, also called the ASOM and CSOM. CSOM is divided into the tuber-tympanic and aticoantral type. Non-suppurative includes otitis media with the fion, also called the glue ear, which is common in children, and aero-otitis, which is a barotrauma. Acute otitis media or acute suppurative otitis media, which is more common in children, less common in adults because of these three factors, which include regression of the adenoids, which is common in children, decreased upper respiratory tract infection. Children are more prone to upper respiratory tract infections, which led to the acute otitis media, and decreased eustachian tube dysfunction. Eustachian tube dysfunctions are more common in children because in them the eustachian tube is wide, short, and horizontally, so there is increased chances of infection transfer from nasopharynx. These things are not common in adults, so children are more prone to acute otitis media. Etiology. It can be an infection which get transferred from the nasopharynx like rhinosinusitis, tonsillitis, adenoid pharyngitis, and faulty feeding techniques for infants. The infection can also get transferred through the perforated tympanic membrane or grommet incision. Also after the operations of the nose and throat, especially in which posterior nasal packing is done. It is most commonly of the bacterial in origin, and if it is viral, it is most common due to secondary bacteria. Pathology include some stages, and these stages are divided into the type of the symptoms or the clinical features we get in the certain stage. First is the tuberoclean, in which the engorgement and the edema occur. Then we get the exudation, which is serous, suppuration, which is the frank pus or mucopurulent exudate, and then resolution or complication. Complications can be mastoiditis and some other things. Clinical features include fullness in the ear, pain which is severe, and the pain is usually relieved when the pus is drained or after the discharge came out of the ear. Patient will say that he feels relief after the discharge came out of his ear. There will be deafness, which is conductive hearing loss type, which can be assessed by the PTA or tuning fork test. The discharge after perforation, which will be mucopurulent, profuse, bloody, and pulsating. There are certain signs which include congested tympanic membrane, loss of the landmarks, and eardrum bulging. There can be the perforation and mastoiditis, which includes edema and the pain. The disease of otitis media or acute otitis media include diffuse otitis externa or fruncle of the boil, the conditions which cause the rhaphidotalgia, and herpes zoster oticus. And this also causes Ramsay-Hunt syndrome, in which there will be the otalgia plus facial nerve palsy. This is called the Ramsay-Hunt syndrome, and it is most common in the immunocompromised patient in the later stage of their age, when their immunity becomes down, most commonly in those in which there will be the herpes zoster infection in the adult age. The management includes symptomatic, which include the rest, analgesic, sedation, and nasal decongestants, antibiotics, myringotomy if bulging eardrum, oral toilet plus antibiotic, eardrops, and tympanoplasty if perforation present. Thanks. So that's for today. In the next video, we will discuss some other topics of the otitis media. Thanks.